Okay, so today my topic is teaching and learning methods. We will discuss, first of all, what is teaching, what is the role of clinical teacher, auditor, researcher, manager. Then we will see some of the teaching methods summary in this slide. So first of all, the definition of like this is from GMC, and they said that all doctors, they have a professional obligation to contribute to the education and training of other doctors, medical students, and non-medical health professional on the team. So as a doctors, we have to train other doctors, medical students, and other non-medical health professional like nurses and our allied medical staff. And doctors involved in teaching must develop the skills, attitudes, and practice of a competent teacher. So this is the requirement by the GMC. And in this lecture, we had to know what is the role of the clinical teacher and what are the recent advances in the medical education, and also how these recent advances in medical education have influenced the delivery of teaching and learning. Actually, it is very important because there are some stations now in the part 3, and they will give you the topic and then they will say do give the lecture. So this is a 12 or 15-minute lecture you have to give, and then they will see your technique, that how you are going to deliver the lecture. So there is one portion here in which we will discuss the technique of giving the lecture. So also they will see the good quality teaching session, how to develop, and what are the principles of adult learning, because there are some principle and there are some techniques which we can use on the adult learning. And then we have to see what is the skill of competent teacher in the clinical settings. So the clinical teacher, if you can see the this picture, you can see here the clinical teacher, auditor, researcher, and manager. As a clinical teacher, what are the requirement? The clinical teacher should be a good assessor. He should be a good planner, information provider, facilitator, role model, and the resource developer. Okay, so some of these qualities. Not all the teachers can have these qualities. For example, if you are working in a setting, but you are partially, if you are dealing with the medical students, or if you are dealing with the trainees, you cannot be at the same time resource developer, role model. You need some training for this resource developing of the curriculum. So at some point in your life, you might be working as an assessor, but you need some training, or you might be working as a facilitator, but you need some training. So some of the features of this chart is this picture. You need some training, and then you become assessor, and then you can
Dr.
become a
Fauzia, there is no
facilitator.
picture.
So I shared in the group, I shared the word document. I told
No,
everybody in
no.
the Telegram group. Did you
There,
open
there.
the?
So we, okay,
Okay,
okay. We have to go to
okay,
there.
fine.
Okay, okay,
Yes,
okay.
you have to open that word document, okay? Because I told in the start that my presentation was be has been deleted by mistake by me, okay? So you have to see this picture in the word document. I shared the picture. Can you see the picture now?
I'm opening, ma'am.
Mm-hmm.
Mm.
Okay, other can open. They can see the picture.
Yes, ma'am.
Okay, fine. So you can see, if you draw a line from this picture, the central line. Okay, if you draw the line, for example, if you draw the line, the assessor and the facilitator, it will cut into the half. So if you want to become a good quality assessor, you need some training also, or you want to become a facilitator, you need some medical expertise. Okay, so planner, an information provider, you need some medical expertise. So we will discuss later on that which of these modalities need clinical plus medical education. Yani you need some training so that you will become a qualified clinical teacher. So in real life, you have some features. You can be a assessor, you can be a planner, you can be an information provider, you can be a facilitator, you can be a role model, you can be a resource developer. But some of these features need special training also, so that you need some medical education training, and then you will be a qualified clinical teacher. Okay, so medical education, if you will see the clinician, they will discuss that how a clinician as a role model, what are the features. And also we will discuss in the medical education the adult learning principle. We will learn the evolution of education and new strategies and outcome based training in teaching. Assessment, there is a full module on assessment, how they are doing assessments, and then some common teaching opportunities. Okay, so first of all we need to know the clinician as a role model. Okay, so physician characteristics, some because there is a one EMQ, they ask about the clinician as a role model. They should express enthusiasm for specialty. For example, if there is a OB/GYN specialist, he should show enthusiasm for the specialty, and also he should demonstrate excellent clinical reasoning skills, and he has to establish close doctor patient relationship and view patient as a whole. So this physician characteristics, they find out when they give questionnaire. They did a study, they give this questionnaires, and they said, they ask the pupil that the clinician as a role model, what qualities they want to see. So for the physician characteristics, the majority say that he should show enthusiasm, he should show clinical reasoning skill, or doctor patient relationship. If your consultant or your teacher, your professor, if he is having good doctor patient relationship, then in your medical life, in your medical school, because they say that majority of the medical students during their undergraduate training, they decide which specialty they want to go, because they see their professor, their role model. Okay, so they will see that how their doctor is treating their patient, and then view patient as a whole. Then the teacher characteristics, enthusiasm for the teaching, and they actively involve the students, and they communicate effectively with the students. So these are the good teacher quality. So in the classroom, the clinician as a role model, he can describe his approach to the clinical problem, and it captures important issues and choices available. So you have to see that if the doctor is very senior, maybe you have a very old professor, but he is not a good teacher, so he have no good communication skills, or he is not actively involving the students. So maybe you don't see this clinician as a role model, as a teacher for you. So seniority is not a criteria. The title that he is doctor, is professor, he is assistant professor, is not a criteria. And the research ability, that he how much papers, maybe 1,000 papers he have wrote, but he's not a good teacher, then you will not take this clinician as a role model. So seniority, title, and research ability of that doctor is not making him a good teacher. Okay, so role model, maybe unconsciously one person is acting as a role model for many doctors and many clinicians. So that means he's not doing an active process. He require no training. He's just doing his job, and other people are taking him as a role model. So it may be happening without the role model even being conscious of it. The mentor is a part of two-way relationship. For example, they are participating is active, so their role is active, and they require training, and they are basically guiding their colleague. And mentor in RCUG definition can be anyone in your setup. For example, maybe your senior registrar is your mentor, but you have to decide, it is the mutual agreement. For example, I will go today to my another senior consultant, and I will tell her, I want you to my mentor. Okay, and if any problem my clinical setting, I will come to you and I will discuss with you. So this is a mutual agreement, and the confidentiality have to maintain between the two. For example, if I will come to her and I will tell her, today I make a mistake, and today I did this patient, for example, I did cesarean for this one, but I think I should do like this, I shouldn't do like this. So I will discuss with my shortcomings, or my concerns, that maybe some sister is not dealing with me good way. So these are the daily day-to-day problems, which after agreement, I will discuss with that mentor. And the confidentiality is the main thing. He will not discuss these things which I discuss with her with another. So this is mentorship is another thing. And but role model, clinician as a role model is another thing. So you have to be, when in the exam they will ask you some definition, the mentor and the role model is different things. So adult learning principles. So what are the adult learning principles? The definition, there is a terminology which is called the andragogy. Andragogy, it refers to the methods and principle applicable in the adult's education. So they discuss this thing that basically learning is a constructive process, And this one definitely you will acquire some new information, and then you will build a structured process, because you already have some baseline knowledge, and then you acquire new information, and then your cognitive process will make organization of this information. You get it, okay? So any new information will act on the baseline information, and through the cognitive process you make organization of this new information, okay? So the way you receive this information, this new information, if it is a structured information, then it will be more easy for the learner to update his information or process the information. So also the learner also should be given the opportunity to reflect that how they get this information, and also is it a good way to give the information? No. So you already, the learner always have to reflect what they learned today. They have to reflect. So there are two type of learning. One is called the surface learning, another is called the deep learning, okay? So surface learning, they said that just I give you the lecture, I give you this Word document, and I told you, okay, go and read this document. This is just any information I am giving to you, and just a factual information. And in this way, if I will not give you the lecture also, I will just give this Word document to you. It's this poor knowledge retention, okay? You will, maybe you will read it or you will not read it, it depends on you. But now at the currently you are actively listening, okay? So we added some one more step ahead. We are one more step ahead. We are trying to take it deep learning, because deep learning is the process of information and critical thinking, both which are essential for lifelong learning. So deep learning is a different thing, and the surface learning is a different thing, okay? So deep learning, it is important to understand how adults are learning. And deep learning depends a way in which information is delivered in a teaching session. And also the learner should reflect on this new information, and how this adds to previous knowledge, allow deeper learning. For example, in the teaching, there is a in the OSCE, there is a teaching session. At the end of whatever they want you to teach this student, for example, they said you just teach this student the shoulder dystocia, for example. So you will have to show him the maneuvers on the mannequins. But at the end of every teaching session, you will ask the learner that how was your teaching, and what you can do, what was the good point, what was the negative point, and you want a learner to tell you how you can improve your teaching. So you will ask the feedback also, and the learner, you can tell the learner that how he can improve his teaching experience by referring him some resources also. So reflection on the new information, and the learner also tell you that now he learned something, but he want more information. Also, you just decide you can come to me next time like this. Next duty you can come to me. So we will discuss more about this one. So like this, the learner have to reflect also. Now the evolution of the educational environment. Previously, they said, if you can see the picture, they said that before, just the educational process was, they were giving the emphasis on the educational process. Now the modern education, they said it should be outcome based. What you want from the doctor, which type of doctor you want. So it is outcome based education. Now the RCOG new curriculum 2019, it's the outcome based education. So they want, they make a criteria that this doctor should be good in communication, good in clinical knowledge, good in information gathering. So they have they have their five module, and in on the basis of those five modules, they are assessing the doctor. So previously, like in our setup, still we are creating doctor whom they don't have the good communication skills. So it was just educational process. You finish your training, you finish your exam, and you become a doctor if you pass the exam. But no, there is modernization, outcome based education. They are giving outcome based module wise. A doctor should uh, what type of doctor they want. So they already decide the criterias. The next thing is traditional approach to the learning. So giving the lecture, they are going to home and just books. This is the traditional approach. The now approach is emphasis on new educational strategies. So they are using the new strategies, they are using the portfolios, they are using the e-learning programs, they are using different team-based learning, word-based tools they are using. So word-based, work-based assessment tools, they have their own tools they are assessing during the training. So they have new educational strategies. Then before, the media use was limited. Now they have increased the use of learning technologies. Before, they use all traditional assessment method, maybe just writing just essay type or just simple methods or multiple choice questions. But now they are assessment tailored to the curriculum needs. What the curricular demands, accordingly, they are the techniques are different. So there are four major changes in the evolution. Okay, so modern educational strategies. First, they said before we are using the classroom model. Either we are going to the class, either we are going to the laboratories. So it was very superficial learning, and students they don't know exactly what to do when they are coming the real life. But now there is new model which is called the apprenticeship model. This is the new model. But in this model, what are the risks in this new model? This new model they make they make environmental based, and they make but the problem in that model is, or simulation model, for example, they create a simulation, or they ask the student to go to the clinical setting. For example, they are saying the student go to the clinics and sit with the consultant and see how they are seeing the patient. So this is the apprenticeship model. Okay, so but the problem in this model also, that it is opportunistic learning. You will see the few cases. For example, if you see the case of abnormal uterine bleeding, maybe in the OPD you will see only the patient with menorrhagia, and you will not see the intermenstrual bleeding, postcoital bleeding patient. So only the opportunistic, some part of the learning. And also, maybe you want to finish that topic, and because you have to spend more time, so it will put more demands of completing the task, interfering the education. So they give two information that two types of model are there: classroom model or this clinical model, which is called the apprenticeship. Very difficult, this one, apprenticeship model. Okay. Okay, so they said, okay, there are another educational strategies also. These are self-directed learning. You can see problem-based learning. There is a task-based learning. There is a system of integration, and there is a simulated environments, and there is ward environment. Sorry, it's not. It's sort of simulation training, and these are the some of the you can say that these are the some of the methods. So these are the educational strategies. So two models are there, and there are different technique. The first technique is self-directed learning. So what is the self-directed learning? Basically, it is put emphasis more on the learner. For example, it's my responsibility. I have to prepare for part 2. Nobody is going to help me. Okay, if I will cover the course, I will not cover the course. This is my responsibility. Okay, so this is my responsibility to cover all the modules. So this is self-directed learning. Okay, so it emphasis towards the person who is doing the learning and ensuring that the learning objective have been achieved. Now there is another type of learning which is called the problem-based learning. For example, I will give you one scenario. For example, I will give you scenario of uterine rupture. So I will divide you in the group, and I will ask you, in this case, what problems you are identifying. For example, I will try to do this as a case of root cause analysis. I want you to see this case and see where were the mistake, what went wrong, what went right, what could be done in the future to prevent these things happen, to be what action you can take. So this is called the problem based learning. You will learn from the process of learning the case, what was the problems, or how you can improve your learning so that this will not happen again. So this is called the problem based learning. It is a period of self directed learning, and the group coming back together to discuss their newly acquired knowledge. So I will give you this case. I will tell you, go and study this case and come back to me and tell me what problems you identified. So you will go, you will open the guidelines, and you will see that, okay, uterine rupture, this previous one was given too much trial, and there was no fetal blood sampling or CTG. There was no action taken on the proper time. So you will come back to me and say this case was not managed according to the guideline. So then what you will do, link scientific and medical theory to the clinical cases. So we will discuss the guideline and discuss this case. Okay, now the role of the tutor in this scenario is that I will just facilitate you in running the discussion and to ensure the learning outcome are achieved. So the role of the teacher or the tutor will, in the problem-based learning, they will just facilitate. They will give the case, they will direct them, okay, what was the problem, what is the good things. So just facilitate the case and then direct the learning process. Okay, go back to the guidelines. So I am directing you to the guidelines. So this problem-based learning is the case-based learning. It is the adaptive form of case-based learning. Okay, the next thing is task-based learning. Actually, they didn't task-based learning that I will give you the task. I will tell you, okay, your task is to do audit. Okay, so after 3 months you come back to me, and then we will discuss that how you do this audits. I give you one task, and then on the basis of that task we will learn something. So this is called the task-based learning. And integration, they didn't give much information on this technique. This is just mentioned the integration. And there is another technique which is called the simulated environment. And I was seeing the recalls and I saw there are many questions which they're asking what type of learning it is. So simulation was there. So what is the simulation? Simulation refers to the replacement or amplification of the real experiences with one that evokes or replicated substantial aspect of the real world in a fully interactive manner within a safe environment. For example, you create a simulation training of shoulder dystocia, and now you are doing this on the mannequin, and it is a safe environment. Definitely there is nobody can teach when there is a shoulder dystocia. So definitely you are creating a safe environment in which you are totally interactive. You are giving the training hand or skill, and then you can just let him to experience the real experience of shoulder dystocia, and later on we can discuss that what was the problem, what maneuvers he do, what maneuver he should not do. So this is the called the simulated based learning. Okay, in this learning, what will happen, it will be a same environment like ward environment. This environment will be said, you could put your mannequin in the labor room and you can just experience the experience of shoulder dystocia. So ward environment is there. This is the benefit of this type of learning. And then also interprofessional education initiative. You can just okay, you can just call your resident and tell him to let us discuss the shoulder dystocia. So it will initiate some professional educational activities. Also, you will assess the good practice. You will see that how your midwives is giving the suprapubic pressure. So you can see the practice is good going on or not going on, whether they are giving the fundal pressure in this situation. You can assess the practice. And then this is a multidisciplinary working. So in this scenario, sometime they are using this environment, and also at the same time they are assessing how the teams are working. They have special now work-based tools in which this is called the team observation, TOI, team observation forms. So they are giving one simulated scenarios, and they are observing that how everybody is reacting on that scenario, on how they are working as a team. Okay. So in this one, human factors training, which is called the non-clinical skills, you can also assess the human factor training. Like you are seeing that how the consultant, the resident, the registrar, the midwives, they are interacting with each other. So this is called the non-clinical skills within the healthcare environment to improve the clinical outcome and the patient safety. They use this word team steps, which is called the team strategies and tools to enhance the performance and patient safety. It works to optimize the team performance. It focuses on domains such as leadership, situation monitoring, mutual support, and communication. In situation monitoring, which is called the situation awareness, there is a latest TOG article, which is called the situation awareness article. And this article give you what is called the situation awareness. This is called the helicopter view. Yani you are a senior person. As a senior person, you are seeing that how your juniors, they are managing. You are not part of, you are just observer there, and you are seeing the situation and you are seeing how everybody is working. So situation monitoring, mutual support, and communication. So this simulated based learning will give you how many techniques or how many things you can like it is a very good way of learning. So high fidelity models can offer additional benefits such as human factor training. So if you are using simple mannequins, this is the low fidelity model. Simple, you are using to teach the breach delivery. This is called the simple fidelity models. But there are some advanced type of models, which is called the desperate deva, and there is another type of mannequins, which also give you high fidelity models in which you can see that how the human factor training, yeah, non-technical skills you can assess. So these are the some of the method of assessment also. Okay, now they talk about use of media and learning technologies. Now we have computers assistant and web-based learning, and also more interaction by the learners. Also, we can use the simulators and models for real life situation, especially if you want to develop some new skills. They have many models. I saw there is model for vaginal hysterectomy, there is model for laparoscopy. So you have models in which you can develop a new skills. And skill drills, they are usually demonstrating the obstetrical emergency. So there is skill drills for eclampsia, for shoulder dystocia, for PPH. If you will go to the guide RCG website, you will see all obstetric emergencies. They recommend at the end of procedure that skill drills for any obstetrical emergency should be there. So breech delivery, breech head stuck. So all these need skill drills to maintain the skill in the junior staff. Okay. There are low fidelity models, which is called the desperate Debra. These are the mannequins, and there is a high computer assisted high fidelity models, which is called the SIMMUMs. And especially they are using for teaching obstetric emergencies. And also these high computer assisted models will tell you human factors training also, that this model will say to you automatically if you delay in delivering the for example, shoulder dystocia, even in 5 minutes, if you will not deliver the baby, if you will make more time in one of the maneuvers, maybe they will give you the time, maybe time limitation, maybe they will speak, or maybe in neonatal resuscitation, maybe give you a feedback that poor resuscitation, maybe baby died, like something like that. I don't know, but I will see. Okay, so SimMum is another type of computer assisted mannequins. Then there are e-learning resources. Basically, e-learning, what are the benefit of e-learning? That you can learn at your own pace according to your duties. You can, if you want to reflect on some topic, you can write on that one. For example, e-portfolio, or for example, the strategy at the end of each strategy modules, you can just go there. There is a portion which is called the reflection. So they're asking you some questions, and you have to reflect on the topic you have learned today. Okay, so e-learning is interactive type of learning. You will get the instant feedback. If you give something wrong, immediately you can click on the answer and you can get the feedback, and then explanation why this answer is correct or incorrect. Also, you can assess your progress. Okay, and also you can even not only knowledge, you can develop the practical skills, because some of the modules will teach you how to do proper laparoscopy, third and fourth degree tears, like proper skill, professional attitude, and self-awareness. And also encourage to think critically and to take responsibility for their, because it is a self-directed learning. E-learning is a type of self-directed learning. Okay, traditional method and e-learning method, they did a studies. Okay, they did a study, and they see that traditional methods and e-learning, when they didn't find, at the end of the day, they didn't find much difference in e-learning and traditional methods. But when they see that, for example, uh, they ask the questionnaires from the students. For example, they give you one lecture on how to operate this thing. So if they say that if they give the lecture face to face, for example, if in the classroom they give the lecture that how to operate this one or how to fill this form, for example, face to face lecture. Another method they try that they give this form online and e-learning. And then they compared those. They said that instead of face-to-face lecture, the online method of teaching was more productive. So this is the only thing to discuss here. So outcome-based education. Now the RCOG, they make a curriculum. Outcome-based education depends on the curriculum. The curriculum is describe the content or what the student studied. This is the curriculum. And old method was the examination to assess the extent to which the student had learned the contents. So you just you have the books, okay, in your exam, in your like your undergraduate, under metric. You give the exam, you have the books, you read, you go there, they will assess your knowledge. They will not see that how competent you was, or you are more clinically good doctor. They just take the exam for your clinical knowledge. This is the old method, the curriculum and the books and the exam. Now in this approach, where the emphasis on the educational process result in the requirement for acceptance of the outcome. You already accept in the MBBS, these are the books, okay, and you have to pass part 2, part 3, part 4, part 5, and then you will become the graduate. This is already decided what they want from you. These are the old methods. Now the new methods are outcome based methods, outcome based education. And outcome based education is, it is an approach to education in which decision about the curriculum are deriving about the outcomes the student should display by the end of the course. For example, now the RCUG make some skills, okay. They decided that okay, at the end of this ST1, the student should able to do the repair of episiotomy. They should do this one, normal delivery. They should like this uncomplicated cesarean section. These are the criteria they put, that okay, this they need to do. If they will do, they will be signed off. They will be signed by their seniors, and they will be signed out for this for ST1. So these are the outcome based education. So at the end of ST1, they should be able to do this one. So this is called the outcome based education. So the outcomes are specified at the start of the planning process and define the product. Yani what kind of doctor you want to produce. For example, the same way, if the article drawing conveys an image of what the building will look like at the end. So this is something you can say blueprints. So outcome based education is like blueprint. You make some blueprints and you want to be, these are the outcomes, okay. The curriculum approaches to the teaching and learning and the assessment are then planned to deliver and assess the predefined outcome. So these are the things they are discussing, okay. Assessment, it's a full module. I will see what's written in the assessment, but in this, basically we are relying assess the professionalism. So this is the assessment. They are how we can decide the professionalism of that person through the assessment process. And also at the end of the assessment, it should not be stopped. After assessment, this person should be encourage more learning. So after I assess you, I will give you the feedback. I will say that you are good in these things, but you need some improvement in these things. So it should encourage the learning. Further, this type of assessment should always be done. Whenever you are giving feedback, you also give the feedback how to improve it. This is a part of assessment. So it should also motivate teachers and students, so that improvement in the teaching and course content also. So every course, at the end of the course, they were giving us the feedback forms, and they are asking how you like this course, what are the things you like in the course, what we can do in the next time so that we can improve our teaching. So we are doing these already drills we are doing already. So this is called assessment. Now there are new technique for assessment, okay. Can you hear my voices? Hello?
Yes, madam.
Okay. I just thought that maybe because I'm using the laptop and the mobile also. Okay, there are new approaches to assessment. There are performance-based assessment, self-assessment, portfolios, profiles, and there are some work-based assessments. Okay, so the performance-based assessment, that how you perform, for example, you did cesarean section and you asked your senior to do assessment for you, which is called the formative assessment, in which you don't want your competency to be signed off. You just want him to see you that whether you are fit for doing this procedure or no, and the next time you will do the summative assessment. Okay, then in this assessment they will sign off you, and they will give you the numbers. Okay, so this is performance based assessment. Then there is a self assessment. At the end of every lecture there are some questions and written at the top, self assessment. Okay, this is simple. Portfolios, in the UK, the trainees, they have portfolios. So they will give you, I don't know how they are working, but when there is a difficult case, they're asking the trainees to reflective clinical practices, that okay, I did this case today, and this is the shortcoming, this is the good points. So the portfolios are theirs, and then there are profiles. So work-based assessment, there are this is case-based discussion, which we already discussed. This is the problem-oriented type of learning. Okay, case-based discussion. Then there is a mini sex and there is a OSATs. OSATs are usually for the clinical skills. Okay, they are formative essays, and these are designed to reflect this in combination with other matters such as team observation. This is TO eyes. These are the team observation forms. Okay, these are the forms. For example, you will observe that how this person is work as a team. So there you ask some of your colleague, okay, senior colleague, okay, doctor, I am going to manage this PPH, please observe me, that how I am working along with the team, how I work. So they will fill the form for you. Maybe in your training you need to form 2 or 3 or 4. We will see later on how many form you need to fill per year. Then there are reflections, you reflect, and then there are traditional exam, MRCG part 1 and MRCG part 3. Okay, and most outcome of the RCG curriculum can be assessed by these methods. So in 2019, the RCOGs, they launched a new curriculum for professional identities, which is PIS. And then there are 14 capabilities in practice within these areas. If you remember, in the WhatsApp group, I share with you maternal medicine module. And then in the start, I share with you that in this module, they want you these capabilities in practice. So there are some capabilities, maybe 6 and 11 and 12, not all capabilities for all modules. So there are some of the capabilities in that particular module is needed, and every capabilities need 4 professional identities, that the clinician work as a teacher, clinician work role as a this. So there are 4 type of things they want from the clinician. Okay, information gatherer, clinical knowledge, or good clinical skills. So these are the type of the thing. So they divide their module, they divide their curriculum according to these criterias. These define professional and specialty specific skills. So there are professional specific skills, as a GMC, what GMC want from a doctor. This is like generalized professional skills. He should be a good communicator. He should maintain a confidentiality. So there are some professional skills every doctor should have. Then every OB/GYN, there is specialty specific skills. So there are some skills which is specialty specific. So they need they define these skills, which should be developed over the course of the training in OB and gynae as proposed to the prescriptive list of conditions and procedures. So they have list of procedure, ST1, ST2, ST3. ST3 should be able to do a diagnostic laparoscopy type 1, level 1, okay, or level 2. Like this, they have some list that he should do, able to do this one, this one, this one. Okay, so it details of the clinical content remain unchanged. And a much stronger focus on non-technical skill, patient safety, and the patient experience. So if you will see that the curriculum is remain same, but they are not now more focusing. They divide the course in part 1, part 2, MRCG part 3. So if there is a maternal medicine, in part 1 exam, they want you to know the pathophysiology of some condition, the chemistry, biochemistry, the basics for part 1. And the same module for part 2, what they want from you, the sign and symptoms, the progress of the disease, they specify in this one. In part 3, for maternal medicine module, how you are communicating with the patient, how you will take the history, how you will information gathering will be there. So application of the clinical knowledge will be in part 3. So every module they divided in part 1, part 2, and part 3. So in this way, the non-technical skills and patient safety and the patient experience will be improved. And there is a strong focus. Before the curriculum was not divided like part 1, part 2, part 3. Now they divide curriculum like this. Okay, so what are the common educational opportunities? There is a reflective task. The reflective task mean you do some task and then you reflect on this one. These are the methods in your real life clinical scenarios you do like this. And even if there is they say if you're in the ward, you have multiple opportunities you can do with your colleague. Case-based discussion you can do in the OPDs, you can do mini sex, you can do if you are in the theater, you can do OSAIDs for clinical skills. So there are multiple opportunities in your ward setting, in your clinical settings, your operation ward setting. You can use all these techniques. Okay, more formal educational sessions. Now this is informal sessions, but if you want to arrange these sessions, you can just before doing this session, first of all, you clear the learning outcomes and then you arrange the time. Okay, this time you will learn, and then you will do some preparation by the teacher and sometime by the students. Okay, so choice of teaching methods facilitate the delivery of material you wish to deliver. So for example, if you want to study the CTG, definitely first of all, you will ask your student to bring the CTG. So depends what type of teaching session you will do. Either you will do lecture, either you will do small group learning, either you will do uh, case-based discussion. You bring the case, you bring the file of the patient. So the stages in the delivery process are first to define what you want to wish, and then you consider the most appropriate educational approach. So these are some educational approach: small group work and facilitation, and lectures, other teaching tools, developing study guides and educational resources, and then taking education further within your careers. So how the small group is working? Okay, now you can come back to this screen, right? Teaching and learning method summary. So first of all, I will tell you type of assessment. I told you there are full module on assessment. What type of assessments and learning are there? There is a formative assessments. What are the formative assessment? These are the range of formal and informal assessment procedure conducted by educators during the learning process in order to provide the feedback and modify teaching and learning activities going forward. Typically involve qualitative rather than quantitative feedback. For example, you want to apply the forceps delivery. Okay, you call your senior registrar and tell them, okay, I am going to, you see how I am doing. So already you have done some supervised for forceps delivery. Now you want to just show him that either you are competent enough to take summative OSAIDs or no. So this is a type of formative OSAID. You will just want feedback for your how you are going to deliver by forceps. So you will get the feedback, and then your assessor will tell you that still you didn't pull well, or your direction of pulling was not correct. So by this feedback you can improve your method. It is a qualitative type. You are not getting the quantitative feedback, just the qualitative. It was good, it was not good, you need improvement. This is a type of this one, non-structured type. Your assessor will not fill the form which is the structured types. It's like a qualitative feedback. So there is a summative assessment. In summative assessment, these typically measures the outcome of an educational outcome. Whatever you have done, you will get the marks. Now you will get the outcome. Okay, sometimes described as high stake, Medical examples would include finals and Royal College membership exams. So part 2, part 1, these are the part 3, even part 3, these are all summative type of assessments. You get the final results, often described as high stakes and often require attaining for progression. So after part 2 you will become ST5. So for ST6 and ST7 you need a part 2 for your progression in your career. Okay, so they say there is some type of norm reference test. What is the norm reference test? This is the name of the assessment, norm reference test. Okay, it is designed to compare and rank test takers in relation to one another. Okay, so norm reference test report whether test takers perform better or worse than a hypothetical average student based on a sample data. Results are relative to a norm IQ, where the median IQ is 100 and pupil IQs are given relative to this. For example, for part 2, they are using the standard. Okay, they have one standard, and for example, any test, there is a written test, and they decided, okay, in this test, the average student who attended the lecture, who attended the courses, he should attain the 60% marks, and every this is the norm for that test, at least 60% average student should take. So this is the norm they set already. This is the normal standard. Okay, now if you go the exam and you take the exam, now you get the 40. So they will give you the marks according to the norm. The normal is 60%, you get the 40%, so they will give you marks accordingly. Okay, so this is the type of assessment. And they give the example of IQ. IQ is 100, they will say your IQ is 80. Einstein IQ is 110. Like that, they've set a norm, and then accordingly they will decide for you. So criterion reference tests. I think this is MRCG exam. They are assessing you part 2, a criterion reference test. In contrast to norm reference test, in criterion reference test, performance is just according to an expected level, a criterion that is not dependent on other test takers. For example, can a runner run 1 kilometer in 5 minutes, or in a math test, can the candidate answer 20 out of 25 questions correctly? So in this criteria, they just they are not comparing the students to each other. They are just they have their criteria, and they say that okay, we want one runner to finish this race in 5 minutes, 1 kilometer. So can they do or no? So they set one criteria, and then they will assess accordingly. So this is called the criterion base. They have one criterion, and then I will tell you later on, because really I forget, the part 2 assessment was criterion based and norm reference based. I need to check this one. Okay, so this refers to the adjustment of test score so that the population of 2 or more forms of a test are comparable. Okay, so for example, linear equating edges so that the two forms have a comparable means and standard deviation. Okay, now they give the example. An example would be comparing result of the MRCG part 2, who set in March 2014 and the sitting in March 2016. Okay, so what they are doing, a candidate on the 5th percentile in the March 2014 exam may have scored 64%, whereas a candidate on the 5th percentile in 2016 scored 69%. So equating allow adjustment so the two candidates would have comparable scores. Yes, it is a criterion basis MRCG part 2. Why I remember this one? Because I think I got this in my part 1. I got this question that MRCOG is a criterion based or norm based. It was criterion based. So how they are calculating? Because when we were comparing our result, that how we are getting the result, we did not understand, because it seemed very difficult that how they are calculating. Because when we are going for exam, they are saying that if you lost the simple questions, that mean you are definitely going to the fail. But if you did not do that question, which was very difficult, it was difficult for everybody. So you will not assess on the base of that difficult question, and you will assess on the base of that simple question which everyone will do correctly. If you will not do that question will correctly, then you can become fail. But if you did not do that difficult question which everybody find difficult, then you will not fail. So this thing I don't understand that time, but now I understand, because they make their own criterion, and they are comparing that in 2014 somebody is getting 50%, now in 2016 somebody is getting 64%. That's mean that time maybe that exam paper was very difficult, so everybody was getting 50%, and the 50% was the passing criteria for 2014, because the exam questions were difficult and for everybody, so they are actually excluding the difficult question at the end, which nobody will be able to get the answer. Okay, but in now 2016 the passing criteria was 65%, because now everybody is for everybody that difficult questions become less difficult question, and now the pass marks was high. So this is called the criterion based the assessment criterion base. Okay, I think I did not confuse you. I try to this try to decrease the confusion. Okay, reflection. What is the reflection? This refers to when one reflect on an action or event to analyze the positive and negative aspect of that event, the reason for the event. This is called a reflective type of. You reflect. You make a mistake. For example, you have uterine rupture in your duty. Now you, in front of your consultant, you reflect on this case, and you see that action. You reflect on the action. You analyze the positive and negative aspect of that events, the reason for the event unfolding in the way it did, and ways in which learning from the event can be utilized in future situations. So every day of your life you have one cases, and you think at home, I should do better than this one. If I do this one, maybe this rupture will be picked up early. There are some signs you missed. So this is called the reflection. Vicarious or observation learning is learning that is derived from hearing or observation rather than via direct instruction. So what you learn from your hearing or what you learn from your observation, I think when we are from the start part, we are the start of our training. First of all, we see the episode me how to repair. This is first of all we observe, and this is called the vicarious learning. This is easy. It is not confusing. Transformative learning. What is transformative learning? Okay, maybe simplistically viewed as a process where someone undertakes critical reflection that lead to a change in their attitude, belief, and or perspective. So again, by reflecting, for example, you have one case. Okay, for example, fully dilated cesarean section. You did fully dilated cesarean section, but head was stuck, and then you call your senior, and then they are the one. And then later on, you learn what mistake you have done. And the next time you will, when you do second stage cesarean section, you will do it better, because already you have you are already know that what problem last time. So now your attitude has been changed, your perspective has been changed. Now you know the methods, you know that what you are going to do. You need to use the methods, maneuvers, change your hand, or make the head and down. There are many maneuvers. So this is called the transformative learning. You have bad experience, from that experience you learn. Now you are doing in a better way. So this is transformative learning. Experiential learning. What is experiential learning? It is the process of learning through personal experience. It is a form of active learning. Experiential learning is a distinct from didactic learning, in which the learner has a passive role. Definition may vary, but experiencing learning arises when the leader have an active role in doing something and can reflect on this one. So the learning which you experience, which you learn from your experiences, this is called the experiential learning. I think it is active learning. Before you doing simple type of cesarean section, and with the time you are doing cesarean with adhesions, this is from your experiences. More you do procedures, learn from your experience. By active the cesarean, more cesarean, more cesarean. So this is experiential learning. So appraisals, what are the appraisals? Appraisal is a performance review. There is an appraiser and there is appraisee. So annually, every year they are doing appraisal meeting. In this meeting, what they are doing, the appraiser is reviewing the performance and may utilize several tools to provide evidence of past achievement. So they will assess you, and an appraisee also, they use different tools, and they will tell, okay, this year I achieved this one, I did how many OSATs, I do like this. So this is a structure, and for this same appraisal meeting you will decide that next year what you are going to do. So appraisal will decide for you the next year task. So it typically involves setting future goals and setting out plans to achieve them. So this is called appraisal. Brainstorming, what is the brainstorming? Okay, I will go back to your this small group. I told you until now how your assessment, they are formative, they are summative, they are learned, they are sorry, norm based, there is criterion based. Okay, so they are for this one. Okay, now how you the small groups working, there are certain techniques in which can learn. So what is the benefit of this technique? You can go back to your Word document. You can see that the small group learning, it is an important educational strategy. Okay, and how you, because in this group the learners are active, they are giving the active participation. Okay, for example, in Telegram group somebody put the question, so everybody is putting the answers, and at the end they give the answer. Then everybody start checking why the answer was correct, why this answer. This is called active participation, learner based. I mean, if the learner are not taking participation, the group will stop. It will be dead. So this is how the groups are working. Then self-directed, the groups are self-directed. They decide, okay, this week we need to finish the module, and then it will help you the deep learning, not the superficial learning. Somebody posts one question, then you will go to the guideline and see why this question is good. In deep learning, not superficial. Okay, this question will come in the exam, I will put the answer A because I know the answer A. This is superficial learning. Deep learning is you will go to the guideline and read full topic for this question and understand why this question answer this one. Then application and development of the ideas, you will get the more ideas in the group. Communication will better. You will develop transferable skills, team working, problem solving. These are the things. Interprofessional opportunities will be high. And then you can understand the difficulties which can arise in the group. For example, you are part of some group and you are not comfortable to talking to your colleague, maybe for personal reason or whatever reason. You feel that discussing in this group is not so, you will find some difficulties and you will know how to overcome these difficulties. And then you will develop some confidence and communication. You will prioritize the task. That group will decide, okay, this task need to be done on the first hand. Then the management, time management, interpersonal skills. So many benefits of small group study. Okay, so the planning the group work. Okay, so running the effective small group will require planning and review. Within OB-GYN group work can be used to achieve a variety of goals. Okay, so you will learn about a specific medical condition, and you can review a guideline or journal article, or you can discuss a management of a clinical case, like you can do the CTG review. Okay, but in this group, first of all, the teacher have to arrange the objective, and then you need a physical manpower. You need to know how many number of students, number of groups, how many teachers are required, number of rooms. Like for part 3, they are arranging OSCE circuits. For this OSCE circuit, this is a group work. Okay, so they will decide that, okay, before conducting the circuits, what we need to what are the requirements. Okay, station writing, examiners, lay examiners. Okay, what type of group it will be? It will be a mixture of students, or are they self-directed, or my like that, and what type of facilitator. So this is something you can see. Okay, during the group activity you can use the icebreakers. You make sure students are understanding. You can debrief, you can facilitate, like that. At the end of group activity, evaluate the sessions and reflect on the experience. So what is the facilitation? Facilitation is one of the key skills required of a tutor who is running effective small group teaching. Okay, now in the exam, they can ask you what is the role of facilitator, mentor. These definition you need to know. The facilitator role is to maintain the functioning of the group and to ensure that the task is completed. So maybe a facilitator is just a facilitator. For example, in our exam, just there is a facilitator who is conducting the exam. What is their role? Just to facilitate yourself for the exam candidates. Okay, if you some questions you cannot read, you can ask the facilitator. Okay, just I cannot read. These are some common problems. Their role is just to facilitate the conduction of exam. So the role of facilitator is just to facilitate the learning process. Okay. So a trainer is likely to have more authority than other member of the group, and the participant will expect the trainer to be more knowledgeable and to take responsibility for the group. Okay, so you can see there is a one picture, and there is a power distribution. This is a trainer and there is a trainees. Okay, so if the power is more with the trainer, he share more responsibility. Responsibility is with the trainer. Okay, because the trainer will tell, okay, now today we will study the teaching. All the power he will direct. He has all the flashcards, all the responsibility on the trainer. This is called the directive learning. Responsibility is with the trainer. Sometimes I'm telling you, okay, just share responsibility. You will bring some flashcard for me. Okay, so bring some questions for me, and we'll share together. I will want to share responsibility from your side. But what is the problem in that one? Maybe you will bring the questions which is not very good quality, or which is not recalls. So what will happen? The increasing risk, we will waste our time, because I know better that which type of questions is needed for the exam. So sheer responsibility will increase the risk. Now, if we will put all the responsibility on the trainees, responsibility is the training, it is non-directive. I will put in the group, okay, whatever you want to learn, just tell me, and everybody will be disturbed. Somebody want in the morning classes, somebody want night classes, somebody want the middle night classes. So this is no direction. Just if I will tell you, okay, 8 o'clock there will be a class, so I will take all responsibility. But if I will tell you which time you want the class, I will share all the responsibility on you. So it will be non-directive. There will be no conclusion at the end. So if more power with the trainer, the responsibility is directed towards the trainer, and if less power with the trainer, responsibility will be non-directive. The group will be shattered. So this is the main thing they are trying to tell you. Okay, so uh, I will tell you the type of group learning. So what are the, okay, you can come back to the slide, please. This I will share, I'm sharing. So there are some technique which is called the small groups. By using these techniques, you can learn. Okay. So there are technique, this technique is called the Delphi technique. And what is the Delphi technique? Basically, it involves gathering information about experts' view of the future. This is based on the assumption that an expert is better able to forecast the future than a person who does not process the same amount of knowledge process. So Delphi technique, I think Delphi technique, when you are developing the RCOG guidelines, what will happen? The expert will sit together, and I think Delphi technique is like that. Experts, they are giving your views, or maybe the review article, the expert will give you review. They will any literature search, they will do the literature search, and they can predict. Or for example, at the end of the NICE guideline or green top guideline, they are giving you the auditable topic or research topic. So this is called the Delphi technique, that they can about experts view of the future. So this is something they can do for you. This is my understanding. We will see if they have some example or no. Donuts round, what is the donuts round? Okay, which involve 4 to 7 medical students and or resident during their surgical ICU rotation. Okay, so what they will do, choose the reading material as a group and are expected to formulate 12 questions based on the week reading. Okay, so there is 7 students or 4 students, what will do, rotation, they select one topic, for example, neonatal resuscitation. But okay, they want to do know how to do appendectomy. So they want to bring everybody will bring the 12 questions. Okay, they read the articles and then they will bring the 12 questions. And they pose these questions to their colleagues in a game show format. Okay, in this scenario, the attending only to bring the donors and to act as a moderator during the session. So this is the same what we were doing in the Telegram group, but we are saying, okay, you today the NICE guideline for cesarean section. Okay, everybody was reading the NICE guideline. So what next day what we are doing, bringing the questions, and first of all I am asking the question, then my colleague, she's asking the questions from the same, like that you are bringing the questions from the some selected topics. So first I will ask the question, then she will ask the question. So this is called the donate rounds. Several weeks following the end of their 3 months ICU rotation, 25 students were sent a questionnaires. Okay, so 25 students were sent a questionnaire. So this is called the donate rounds. So I think from I don't understand what they are trying, because I took some copy pasting from some other persons. Anyhow, this is what the donut round. Everybody in the group format, they bring their questions, they bring their donuts. Okay, what is the goldfish bowls? An inner group performs a task while an outer group observe for themes, patterns, and soundness of arguments and group dynamics. The observing groups gives feedbacks and then roles are reversed. Okay, this is like part 3 preparation. You have passive learners. If you will see the courses, they will offer you, are you want to active listener or passive listener. If you want to be active listener, if you want to be active participant, you want to present, you have to pay more. But if you don't want to present, you just want to observe how others are observing, just passive listener, then you have to pay less. So this is the type of goldfish bowls, the courses. They will offer you, either you want to be an active participant or you want to be a passive listener. So what you can do at the end, you can, in your mind, you can give the feedback. Sometimes you are giving, they're asking, the mentors, they're asking directly, what you think that this doctor present, how she presents. So maybe you are giving opportunity to give your feedback, but in your mind sometimes you are thinking how beautifully she presented this station, or sometimes you are saying how badly she presented this station. So this is the feedback you can give actively, or you can give in your mind, and then roles are reversed, and then next time maybe you will become the active participant. So this is called the goldfish bowls in the OSCE exam, in the circuits, how you are doing. Even in the real scenarios, so the paid courses, RCOG, what they are going, they make you a pair. So what will happen? One station you are act as a observer, and the next station you will act as a participant, because they don't have much arrangement. So they are using this technique, goldfish bowl. Okay, so problem-based learning, which is called, we already discussed, it was like case-based discussion. In this technique, learners are given a problem or case to discuss, and then using self-directed learning, they are encouraged to identify and research their own learning objective. Okay, whatever it is, you are giving one case, for example, uterine rupture, and now a case-based discussion, you will discuss that, okay, what could be done better, what was the ethical issues, what were the, you will, it is self-directed learning, and you will be given to research their own, and you come back with the conclusion. You will come back with more questions, you will come back with more organized way. Okay, and you can discuss the case better after reading your guidelines. So an example will be a case involving the organization of a multi-professional teaching session for a small group of midwives and medical students on the subject of termination of pregnancy for fetal abnormalities. Over a 2 weeks period, the learner have 3 1 or 2 hour session with a facilitator. So they said there is a small group. The topic was termination of pregnancy for fetal abnormalities. And then they have 2 periods, and then every time they have sessions, and they were giving cases, and they have learning in this way, problem based learning. So what is the schema activation? An example would be the task of providing a tutorial to specialist training in year 1 and year 2 on the management of genitourinary prolapse. Okay, so what you will do, you will give the tutorial. Okay, the clinical teacher would initially apply schema activation to revise the learner's knowledge of pelvic floor anatomy, which had been taught years before, but the knowledge of which is essential to all the learners in the group. So what will happen? They want you, they will give you the tutorial and genitourinary prolapse. But before that, you already learned in MBBS your anatomy, but because it was long time before, so before giving a higher type of lecture, higher type of tutorial, what they give you, schema activation, they give you this one. They actually activate your old memory, whatever your old memory was, your memory, you have learned this topic, pelvic floor anatomy, but by this tutorial, your knowledge will be revised. It will be freshened. So this is the technique. The knowledge is there, but it needs revision. So this is the knowledge of which is essential to all the learner. Until you will not know the pelvic floor anatomy, you will not understand this genitourinary prolapse. So this is called a schema activation. Before giving the actual lecture, you want to revise the basic knowledge. So this is called the schema activation. And then there is a definition which is called the schema refinement. Okay, so this is for advanced learner. Okay, already you have revised your already your basic information is there. So in this technique, the learners are encouraged to apply the basic concept, clarify their understanding and solve the clinical problem. For example, all of you will know what is the premenstrual syndrome. I will not waste my time to tell you what is the premenstrual syndrome. I will just give you the questions or EMQ, and I will tell you, okay, this is the question of premenstrual syndrome. In this lecture, in this schema refinement, I will not tell you the premenstrual syndrome, the pathology, all those things. I will not tell you. I will just give you the questions, and in this way, you can clarify your understanding, and you will solve the clinical problem. In this patient, you will give the complementary method. In this patient, you will give the hormonal method. In this patient, you will give the cognitive behavioral therapy. In this patient, you will give, because in this patient this is not suitable, the hormone is not suitable, this is not suitable. Like this is the way of defining your baseline information. Schema refinement. Okay, so one example would be the use of tutorial on the anatomy, physiology, and endocrinology appropriate to amenorrhea, followed by a series of clinical cases. So you just do anatomy, physiology, endocrinology for amenorrhea. Then you will give the scenarios, case scenarios. So actually schema activation. First of all, anatomy, physiology, endocrinology. It is the schema activation, and then a case scenario is a schema refinement. Now you give the schema refinement. You will just more advanced teaching. Okay, simplified procedural hierarchy. This is easy. In simply, you know how to do the something. For example, a teacher has been instructed how to do the diagnostic laparoscopy. So you will just show how to assemble the laparoscopic instrument. This is a simple procedure. What is the snowballing? Snowballing is you throw the snowball. You will throw the snowball to somebody, and they will throw back. You will understand. I will just tell you later on. First of all, read the definition. This is a useful technique to imply if the teacher is unsure of the current level of knowledge or skills of the learner. So what I will do, I will throw the snowball to you, and then you will throw back to me. So the force you will throw back to me will make me understand, okay, how I will get the response. Okay, so maybe you will throw back to me the smaller snowballs, or you will throw back to me the bigger snowballs. So according to your response, I will again throw back to you. Okay, if you will throw back to me the smaller one, I will try to throw back to you according to your according to your response. I will react back. So this is called as snowballing. By throwing the snow on his listeners, you will understand the way they respond, then you will deliver the lecture. So this is called the method by which the teacher understand that how much knowledge you have. For example, yesterday I asked you how many of you have a strategy, because accordingly, I want to give you the lecture whether you have strategy or no. If you don't have strategy, that means whatever the knowledge you have, you are taking from the guidelines. So this is the way of snowballing I did yesterday. So by this example, you understand what is this method. This is not an ideal situation, but it could arise. The discussion may be very basic and unstructured at first. However, it becomes obvious that the knowledge base of the learners is high and the discussion is allowed to snowball, increase in intensity and importance. For example, if I am dealing with the medical graduates, I will give the lecture accordingly. But if I am dealing with the part two candidates, I will deliver the lecture accordingly. So by snowballing, you will understand the level of the knowledge of your audience, and accordingly, you will start your lecture from that level. You don't want to waste the time. Okay, complex procedural hierarchy is what we are doing in our training. Okay, in which this technique a hierarchy is involved, which develops over several encounters over a significant time span. For example, a consultant asks the trainee to do total abdominal hysterectomy. Okay, so after several operations, the trainee will undergo first of all observational techniques. He will do observational surgical techniques. Then there will be a rapport between the consultant and trainee. Then the consultant will ask the trainee to do the operation. Then they will have the any. This is the 1, 2, 3, 4, 5 step. First step is observation. Second step is you will do some procedure direct supervision. The second third step will be under indirect supervision, and then there will be the you will do independent surgery. Like that, they are saying this is hierarchical learning for complex procedures. So first of all, you will just do suturing, maybe handling of the instruments. Later on, they will do more and more steps. Like that, the consultant then assists the training in the procedure. So at the end, he will do summative assessment for you. Formative assessment, do summative assessment at the end of the procedure after many steps. Simple, more complex, more complex. So you will learn a complex procedure by by this technique, complex procedure hierarchy. Okay. So okay. So they said they make some, I think some which is called what is called like EMQ type of this summary. That formative assessment, it is basically a quantitative feedback. You give feedback quantitatively. Actually, it is not quantitative; it's a qualitative feedback. You are not giving quantitative. You are giving the qualitative feedback. It's not a part of your final assessment. You are just giving the your views, feedback, that how you can improve. But summative assessment will tell you you are pass or fail. For example, MRCOG exams or summative or SATs. Norm reference test is compare result to the normal standard. What normal standard is, that the normal average student will gain this mark, 60% marks. So you will compare result to the normal standard. The, and then there is a criterion reference test, compare result to certain criterion expected standard, not the normal standard. So expected standards, for example, 2014, the students take 50% marks, and now 2016 the students take 60% marks. So it's according to certain criterion, not the normal standard. Normal standard is okay, part MRCOG part 2, 70% will be if you will get 70% marks, you will pass. If you will gain 69% marks, you will fail. No, every time the pass percentage is different. So this is according to type of student sitting on that particular time. Okay, if all the students come very well prepared, so for them that paper, difficult paper, it will become according to that time that students are giving the paper according to that time criteria. But the normal standard is you set one criteria. You will, for example, you are conducting the interview, and you say that if this candidate will get the 70% marks, he will get the job. Okay, if they are not taking this percentage, so they will not get the job. So there is a exact criteria 70%, but the criterion it's not like it's fluctuating. Okay, so equating like comparison result of two exam, like cutoff marks of parting two different exam of MRCOG. This is called equating. I don't know, I first time see this definition. Equating is like you compare the results of two exams. Okay, Reflection, one reflect on an action or event and analyze the positive and negative aspect of that event. For example, you have major event, you have near miss, and then you will reflect on that one, root cause analysis. You will do root why this happened, what was went wrong, like this reflect. And then transformative learning, you have bad experience, for example, second stage cesarean section, and then you learn from this experience. Now next time you do better. This is called the transformative learning. Now you know the maneuvers, you know what to do. So this is change in your behavior and your techniques and your perspective. Then experiential learning, which is you will learn and you do more cesarean, you learn more. It is called experiential learning, and it is a form of active learning by practice. You do more practice and then you do more better. And even transformative learning, that you manage the pph case very poorly, but next time because you learned something, this experience, that next time you become more better, you perform more better in management of pph. Okay, appraisal, setting future goals and setting your plans to achieve them. And brainstorming is spontaneous group discussion in which you will promote the clinical and critical thinking in trainees who are of a relatively early stage in their careers. Okay, so brainstorming, I think it's missed here. Brainstorming mean you are just giving the lecture. Okay, I give you the lecture today. At the end of this session, I will ask you some questions related to that lecture. So I will brainstorm you, because even giving the lecture, I feel sometimes I am giving lecture alone. I don't know. So at the end of the lecture, I will ask you, I will brainstorm you. If your brain already sleep, I will storm your brain by asking the questions, because I will ask the questions. And this is the way of brainstorming. You learn and then you answer, then you, because I am now brainstorming by asking the questions. Okay. Okay. So Delphi technique, take experience from expert. I believe this is the way how you are doing the this one, take experiences from expert, how you are taking expert opinion, or this is just give it, because what I remember that how the experts, they are developing the green top guideline. So let me see if I can find another example. Okay. Okay, so donut rounds, approach to self-directed learning. Students were told with topic would be discussed a week prior to the session. And okay, like everybody will bring the donut with them. They will bring one questions or 12 questions with them. And they were expected to revise the subject matters and prepare some straightforward question related to the topic. This is called a donuts round. During each session, student took turn to ask their questions to other in the group in a game show format. So this is called a donut show, donuts rounds. Okay. Goldfish bowl is like that. One group is observed, another group participate. Like in RCOG OSCE circuits, one person, one day they are making one. They are making two groups. They will tell you today this group A will be listener only or observer only, and the another group B, he will participate. The next day they will tell now the group A will be the active participant and the group B will be the observer. So this is called the goldfish bubble, which majority of courses they are using in part 3 preparation. This is, I'm just giving you the example so that you remember. The goldfish bubble is the courses, the way they are conducting. Problem-based learning is the case-based learning. The groups are giving a problem or case, and then we will discuss what we can do, what went wrong, guidelines, all these things. Multi-professional teaching session for a small group of midwife and medical students on the subject of termination of pregnancy for fetal abnormality. So they were giving the they have this topic and they were giving different case scenarios, and then this is the way they teach the students. They study this thing 2 weeks, 1 to 2 hour sessions. Okay. Schema activation is like I like to explain a basic knowledge in anatomy to understand steps of pelvic operations. So before giving the information on the genital wall prolapse or any operations for genital wall prolapse, they do revision of pelvic floor anatomy. It is called the schema activation. Then first of all they activate your brain, and then they will do refinement. Then they use more refined method for teaching for advanced learner. They will ask you the EMQs, SPA, now to refine your knowledge. So, for example, endocrinology, like use knowledge in endocrinology to understand a complex scenario for amenorrhea. Snowballing is that, first of all, teacher throw the snowball and want to know what type of response he will get. So this is called a snowballing. If you will throw me the smaller snowballs, that I will understand your knowledge is not so good. But if you will throw back to me bigger snowballs, I will understand that from your response that what type of lecture you need. So it start by easy explanations, and once be sure that the students have knowledge, the discussion intensified and become more deeper. So after assessing your knowledge, then step by step, I will give you the more details. Then simplified procedure hike is a passive learning. Just you go one station, they will teach you how to do diagnostic laparoscopy, and you come back. This is nothing is there. The teacher initially show the trainee how to assemble the laparoscopic equipment. And complexes like how to learn hysterectomy from assistant till doing independently. Okay, this one finished. Okay. So, are you still with me? Hello?
Yes, yes, we are with you.
Okay. So, lectures, now come back to this Word document, lectures. Lectures. So, in the lecture, what you will do, this is why this is important lectures, because I think the part 3 module exam also, they will tell you that, okay, give the lecture on this topic. This is one of the we have the station like okay, give lecture on this one, diathermy. Okay, this is very common question. So what should be in the lecture? First of all, what is the best method to teach this topic? First of all, you have to understand. Then you have to organize the lecture. This is something you can give the feedback that the lecture was organized. Like today lecture is very unorganized. Okay, so is the lecture is organized or no? Or what is the best method, whiteboards or presentation or PowerPoint? What is the best method to give the lecture? Then lecture should be well structured, and then outline should be at the beginning. I have to tell you in the start what we are going to study, and then at the end of the topic we need to summarize, like just now we did. We summarize whatever we read, we summarize. Okay, and before starting, I told you what we are going to learn today. This is called a structured, well structured lecture. Then did the example illustration, there are pictures are there. Okay, and then the pace of delivery, and did you able to make the notes, or lecture was very fast, or did you still, because lecture is very long now, did you still able to pay attention or no? And do you feel stressed or overwhelmed in the lecture, that because too much information I am giving to you, and you are now, if you are listening first time teaching, then teaching this one, then maybe you are overwhelmed. But if you already have some knowledge, maybe you are not overwhelmed. And then the lecturers, some, because I know some of the lecturers, they are giving the lecture in a monotonous voice. So is it monotony, or is there is any emphasis or something? Did they keep your attention throughout or no? Or are there enthusiastic lectures, or there are some objectives in this lecture or no? Or there was some sort of self assessment or no? So these are the something you can assess the lectures or quality of lectures. Okay. Okay, so mhm. So I will just skip this one. These are the lecture plan. Any lecture, you have to know title, objective, methods, and time, how long you will spend on the lecture, topic, content, activity, visual aids. So these are the things. Okay. Okay, so teaching tools, we already learned brainstorming. Brainstormings are a simple and effective method of generating ideas and suggestions. And the object of any brainstorm is to generate a large number of ideas without worrying too much about their quality, as the raw result are then sorted and prioritized. So simple is that you just you have one topic, and then you brainstorm. You will ask your audience different questions, no matter whatever the quality is, that you just brainstorm there. Keep asking the questions during using the flashcards, flip charts. You This is called the brainstorming. Engage your audience. So what is the benefit? That is you will just ask from your audience also, because more brains, more questions, more ideas. So this is you this is the better way. Instead of working one person working by themselves, you will go home. Like for example, today you will just open the strategy module and learn by yourself. Maybe it will take more time, and instead of in the group when we are all discussing the answers, questions, it will be a brainstorming type of session. Okay. Snowballing already I described. Okay. Case studies, this is simple study guide. They talk about the study guide and educational resource development, that you can prepare MRCG part 2 better if somebody give you the study guide and educational resources. For example, the many courses, what they are doing, they are giving you the weekly weekly schedule, and then asking you in this schedule you will do this, you will read from that. So this is called a study guide and educate the structures studying. Okay, so they will tell you what you need to learn, how you can pass this exam. Okay, then they will give you the mock test so that you will do assessments like that. So this is what study guide it is. Okay, but the guidance should be informative, integrated, interactive, and interesting. Okay. Now at the end of the lecture, you can see the key points. It's very important. First of all, key point is medical education is considered to be part of all practicing doctors' role. All doctors need to give the medical education to their juniors. All role as a clinical teacher require medical knowledge, skills, and attitude. And but some roles, for example, to work as a resource developer, or work as a full-time facilitator, or work as a full-time assessor, they need some sort of medical education training. They need also training. So there is a trained educator trains the trainer. For example, you have prompt manual for obstetrical emergency, but there is a prompt for as you as a trainee to attend that course, but there is a course to train the trainer, the one who is conducting the prompt course. So their courses train the trainer, so the trainers also need the training. So being a positive role model can impact on colleague professional behavior and future career choice. Many of you choose OB-GYN because you are impressed from some of your teacher. So it is important to understand how adults learns. Okay, and also the way in which information is delivered in a teaching session can influence how an individual learns. So it depends on the method of teaching. It will influence how much knowledge the learner will get. So reflect on new information and how this add to previous knowledge allow deeper learning. For example, simple giving the lecture, instead of that you get this information and then also reflect on the information, do some EMQs, SBAs at the end of the lecture would help you. Okay, there are new trends in education, there are new strategies, new curriculums are there, already we discussed. And also now the curriculums are basically outcome based. And now how they are doing the assessments, they are doing assessment competence based rather than comparing student to one another. For example, you have OSATs form in which there is a list of things in which they will assess you. For example, episiotomy, they will assess you how you do suturing, how you make knots, the way you make knots. There is a structures assessment competency, not like you do episiotomy repair, this student did better repair than this student. No, you have the structure. If you both are do good, both are good, both are not comparing one to another. So there are new techniques of assessments. And also the method of teaching will influence the learning, and there are new educational strategies, simulations, and then the technology is there in education. Small group learning is an effective teaching method for deeper learning and group working skills. In small group learning, we discuss about techniques, different techniques, this Delphi techniques, donut techniques, and brainstorming, this one, snowballing. These are all small group learning. It's an effective teaching method. And then for any successful session, you need planning and review. Facilitator is a key role required of the tutor within small group teaching. You need a facilitator. If more power to the facilitator, the group will be directive. If less power to the facilitator, the group will become non-directive. Okay, so lecture is a good, useful to introduce a subject to the students. Okay. Okay. Now I will ask you some questions. I didn't put the answers here, or anybody can give me the answers, and then we will finish this lecture. Okay. How many of you are remaining? Because I cannot see how many participants are remaining. Okay, so 7 participants. I think it becomes so late. So are you ready for the questions? I think only 5 all Pakistani, it's too late for them. Okay, I will stop this lecture and you can come back if you find difficulty answering this question. Or you want to answer? You have to answer me. Are you sleeping or what? Anybody can answer? Hello? Yeah, Dr. Muna. You are willing to answer or you are not in the mood? Just tell me or I will see. Can I ask you the question you are willing to answer, or you want me to just leave here and you will see if you have any difficulties you can ask me tomorrow in the group? Just tell me, you want me to ask the question or no?
I think we should revise definitions first because very
Okay.
difficult.
Okay. Okay, fine.
But you can reply it,
Okay,
thank
I
you
put
so much.
some questions here. Okay. And if
Okay.
you cannot if you find difficulties, you can come back to me. Okay. Okay, I will finish this lecture here. It is too long, 2 hours now. Okay.
Thank you so much
Thank
for
you
your
for,
effort.
yes, yes. I think today all leave because it is 2 and Dr. Azala, she's just joining. I'm sorry because I cannot see in the class. Okay. Okay, how to end this lecture?